way we clean ears is exceptionally important in getting rid of debris that's in the canal. The debris is a combination of wax and cellular matter that's coming off of the ear canal, and it does three things. One, it causes a lot of irritation and inflammation. Two, it harbors the infection that's in there, and it also prevents the medication from getting onto the surface of the ear canal. So it's very important cleaning it out, and the procedure we use to do it is important in order to have an effective cleaning. So the first thing I'm going to do, I don't know if you could maybe stand on this side so she doesn't try to get away from me, is I'm going to get some clippers, and I'm actually going to clip a little bit of the hair away from here. This will make it easier for you to get in there and get things out of the way. A normal ear canal should be perfectly clean. There shouldn't be any wax like this at all. If you see wax in the upper part opening to the ear canal, it means there's something else going on deeper down in there. So the procedure goes like this. You need some tissues and you need the cleaner. You need a helper probably to hold your pet. It's best if you get them up on a table, and I'll take care of this ear here. Basically, you want to hold the ear flap very firmly up. You can see my knuckles white. I'm not babying it. You can really squeeze it and it won't hurt. The next step is to actually fill the ear canal with the cleaner. Don't just put in a few drops. I want you to fill it until you see it welling up and actually overflowing like that. And then the mistake a lot of people make is they just go like this, which basically is pushing everything down towards the eardrum and potentially even rupturing the eardrum. Our goal is to get things to come up and out. So the eardrum starts way down here. You can actually feel a little cartilaginous structure, and when I push it, you can see the fluid coming up. So we want to be massaging up so that you can see it coming up and out. And you can actually see black stuff starting to come up and out of there a little bit. I like a foaming ear cleaner because the foam tends to lift stuff up out of the canal as well. So massage it pretty vigorously and then wipe it out. You can stick your finger down in there. You're not going to be able to get anywhere near the eardrum. So I wipe off what I can. Then I like to take another corner of the Kleenex and actually stuff it down in the ear canal. Stuff it in there pretty good. And massage again. And that will help to soak up any of the residual cleaner that's down in the ear canal. For bigger dogs, sometimes 2 Kleenexes or tissues are needed. We want to clean it off good, get rid of any debris that comes out, and maybe one more time I'm going to stuff a Kleenex down right down in there. Massage. And that's it. We have a clean canal, not just up here where you can see it, it's also clean all the way down to the eardrum. So periodically doing this to get rid of the wax and debris that's accumulating is a very important part of the treatment, along with the medicated drops that will be used after this. It's a good idea if you can wait a couple of hours after the flushing to put in the drops. That way any residual cleaner won't still be in there to dilute the medicated drops. So that's it.